When Sarah's family experienced the war in Africa, it was a very scary time. As confusing and frightening as it was for her parents, it was even more so for 8-year-old Sarah. Being under the threat of the soldiers who invaded her house, with her mother hiding the children under the table while they accosted her father at gunpoint, seeing her parents terrified, fearing that they would all be killed, there was no way an 8-year-old could process that. And Sarah's parents didn't have the time to help her process it, as they had to pack up the family quickly and get out of there and get to safety. And then it was a long journey to safety as they had to get out of the village, as they got to shelters. Even once in the States, nobody talked about it. One indication that it might have been haunting her father was his drinking. And because it was never emotionally processed, it continues to haunt her. So we need to help her process it. We'll do that in sessions with imaginal exposure to the memory of the event, and for homework with in vivo exposures to situations in her current daily life that are realistically safe, but that she avoids. In my first meeting with Sarah, I would determine what her presenting complaint is, gather information about that, aiming to make a diagnosis. I always include a trauma history, and with Sarah, it will reveal her experiences with the war in Africa and her father's abuse of her mother. I suspect I will also diagnose Sarah with depression secondary to PTSD, what she may deny. I'll explain that if I'm correct, once we treat the PTSD, the depressive symptoms should improve. I'll discuss treatment choices and hopefully we'll gain consent to begin PE the next session. I'll explain to her how PTSD developed and that avoidance helped it develop and avoidance maintains it. And so that means we have to counter that avoidance with an exposure therapy, that we have to talk about it on purpose and help her confront these scary situations that are realistically safe on purpose, long enough to teach her body and her brain that this situation does not pose the same level of threat as her body feels like it is. In the first session, I'll present an overview of the treatment and procedures we'll use. I'll gather more detailed information about the traumatic event. I'll teach her the breathing retraining and assign her homework to practice the breathing. I'm going to ask her to practice the breathing at least twice a day. I'll give her a tape of it, but I'm going to ask her not to become dependent on the tape, to maybe practice one day with the tape, one day without, or one time with the tape and the next time without, because I want her to learn how to do it on her own. We'll determine what we call the index trauma, which is the one that's haunting her the most. And the way we determine that is the trauma that's most associated with current re-experiencing symptoms. In every subsequent session, I'll begin by reviewing her homework and presenting the agenda for that session. Homework is always going to include practicing the breathing, practicing imaginal exposure, and practicing in vivo exposure. In the second PE session, I'm going to educate Sarah about the common reactions to trauma and give her a handout. I might want to ask her, I do it frequently, to share this handout with her husband. I might not do it immediately, that we might want to put that up on the hierarchy to talk about this with her husband, because if she hasn't even told her husband about the problems she's having and that she's going to therapy, that might be big to start right away. But I like it when people share the common reactions to trauma handout with loved ones, because that helps them understand what they're going through. In that second session, we're going to discuss the rationale for exposure. And in that second, we're going to emphasize in vivo exposure. And then we're going to construct the in vivo exposure hierarchy. As we said, this involves exposure to situations, people, places, conversation, anything that Sarah's been avoiding, either because they scare her or because they trigger feelings and memories associated with the war in Somalia or the abuse by her father. I do suspect we're going to encounter some difficulties there, as Sarah may deny avoidance. Sometimes patients like Sarah just think these are good habits. They are careful habits, and it's not avoidance. So it's going to take some discussion to get her to see that these habits, as she might call them, are actually avoidances and not necessary safety practices. And again, this might be similar to the discussion that we have when we're working on the in vivo exposure hierarchy and asking about other parents that she thinks has good judgment. And would they require their kids to do this, or do they require to do this to feel safe? I'll just add, if patients are using safety behaviors during exposure, then they won't have the level of learning and decreased distress that they want, because they'll think it might be because of the safety behavior. So we really need to sniff out any safety behaviors and identify them and get the patients not to do them. In session 3, I'll present the rationale for imaginal exposure, and we'll conduct our first imaginal exposure of the entire trauma memory. I'm going to tape record that, usually on their phone, so they have it to listen to. We'll start imaginal exposure to the index trauma, which is what happened that night in Somalia. As soon as she opens her eyes from the imaginal exposure, I'll ask her, how was that for you? What did you notice? And we'll engage in emotional processing of the material that emerged during the exposure. I am also going to reinforce the heck out of her. I'm going to reinforce her for coming to therapy. I'm going to reinforce her for coming to every session. I'm going to reinforce her for doing every bit of homework. I'm going to reinforce her for telling me about this. I'm going to reinforce her for sticking with it. She is going to need, I think, a lot of reinforcement to help her do this process. We'll continue this in session 4, maybe session 5, depending on how she does.